the October 2020 edition of AJP-Heart and Circulatory Physiology Video Table of Contents, or from the editor's desk. This month we have published an array of papers ranging from reviews to innovative methodology and rapid reports. So let's take a peek inside. I think you'll enjoy. An interesting review article by Wernley and Zhao. They discuss the role of purinergic receptors in cardiovascular disease. They discuss activation of purinergic receptors and their critical involvement in the development and progression of cardiovascular disease, including atherosclerosis, ischemic heart disease, hypertension, and diabetes. The review focuses on the various purinergic receptor subtypes and discusses the promising purinergic drugs used in clinical studies for the treatment of cardiovascular disease. Finally, the review updates experimental evidence for many purinergic receptors that can be considered as therapeutic targets for future drug development. Higashi et al. Generated endothelial-specific IGF-1 receptor-deficient mice on an ApoE-deficient background to assess the effects of IGF-1 on the endothelium in the context of hyperlipidemia-induced atherosclerosis. Endothelial deficiency of IGF-1 receptor promoted atherosclerotic burden when animals were fed a high-fat diet for 12 weeks. Under the normal chow feeding condition, the vascular relaxation response to acetylcholine was increased in the endothelial IGF-1R deficient aorta. However, feeding of a high-fat diet substantially attenuated the relaxation response, and there was no difference between endothelial IGF-1R deficient and control mice. The endothelium and its intracellular junctions provide a barrier function to the vasculature. In human aortic endothelial cells, IGF-1 upregulated occludin, claudin-5, VE cadherin, JAM-A, and CD31 expression levels, and vice versa. Specific IGF-1 receptor inhibitor, picopopathillin, an IGF-1 neutralizing antibody, or siRNA, and IGF-1R abolished the IGF-1 effects on junction and adherence proteins, suggesting that IGF-1 promoted endothelial barrier function. Matisik and co-workers hypothesized that overexpression of the ubiquitin ligase WWP1 in the heart would cause left ventricular hypertrophy as well as functional and structural changes consistent with the aging HFpEF phenotype. Global WWP1 overexpression was achieved in mice and echocardiography performed to measure LV mass, ejection fraction, Doppler velocities, E to A ratio, myocardial relaxation, and isovolumetric relaxation time. Echo parameters indicated a HFpEF phenotype. Collagen percent area increased by over twofold and fibrilla collagen expression over 1.5-fold. With WWP1 overexpression. WWP1 with an anti-WWP1 antibody could be identified in isolated cardiofibroblasts, with WWP1 increasing over twofold in overexpressed fibroblasts. Targeting the WWP1 pathway may be a novel therapeutic target for this intractable form of heart failure associated with aging. Kang et al. Investigated the endothelial glycocalyx, a protective surface layer on the endothelial cells serving as a molecular sieve, cell adhesion modulator, and microsensor for blood flow. Here they demonstrate by confocal microscopy in Sprague-Dawley male rats fed a 12-week high cholesterol diet that the dimension of the endothelial glycocalyx is reduced significantly in both the common carotid artery and the internal sinus region. Furthermore, they show that this dimensional modification of endothelial glycocalyx may be attributed to a significant downregulation of heparan sulfate proteoglycan-related genes, including syndecan-3, glypican-1, and EXT1, not resulting from an enhanced shedding of sulfated glycosamines from the vessel wall to the plasma. Meanwhile, the mean contraction and relaxation forces of the common carotid artery with responses to norepinephrine and acetylcholine decreased 0.34 and 0.13-fold respectively, accompanied by a lower level of nitric oxide release. Finally, Weintraub and Fock provide a novel methodological study of individual atherosclerotic plaques. The aim was to introduce and discuss a computational framework to provide insight to clinicians and help them visualize internal plaque dynamics. They used partial differential equations with macrophages, necrotic cells, oxidized lipids, oxygen concentration, and platelet-derived growth factor as a primary variables, coupled to a biomechanical model to describe vessel growth. The model is deterministic, providing mechanical and morphological and histological characteristics of an atherosclerotic vessel at any desired future time point. A systems biology model consisting of 5 differential equations was able to capture the morphology of the necrotic cores residing within vulnerable atherosclerotic plaques. Thank you for watching this month's video table of contents. Go to our homepage and see all of the other great cardiovascular science in this month's issue. We look forward to seeing you in November. Try not to Zoom too much, and don't forget, send us your best work now.